welcome back to Sunrise. Now, springtime for humans means allergies and colds, but springtime for our pup friends means an uptick in tick fever, which is a serious tick-borne disease affecting canines globally. So here to tell us more about the symptoms, the diagnosis, treatment, prevention, and environmental management strategies related to tick fever, emphasizing the importance of early detection and proactive care for our furry companions, is veterinarian Dr. Mickha Francis. Hi, Dr. Francis.
Thank you for having me.
Listen, thank you for coming, but in the break I was having a whole meltdown because of these ticks.
Oh, yes, they are a problem.
They are a problem.
They are a big problem.
So tell us, first of all, how do we even know if our dogs have ticks?
Yes. Ticks. All right. So firstly, let me just give you a, because person may say, what is the tick fever? I've never heard about that, but it's highly unlikely in Jamaica that they've never heard about it. But let me just give you first what really is the tick fever. So tick fever really is just a bacterial infection that's usually colonized inside the ticks. So when the ticks bite your animal, they release those bacteria inside their bloodstream. And then basically what happens is that they spike the temperature, the animals start to get sick, start to get lethargic, comes off their food. So you'll find that those symptoms start to progress over time. But the quickest thing for you to know if your dog has tick fever is if you see them start to come off their food, because that's one of the most common signs. They stop eating, they lose their appetite completely, and they start to look lethargic, like dull and depressed. You know, they're not wagging the tail, and as the name wags, they're not getting waggy. So that usually happens. And then what you can do at home is just kind of use your hand to rub along the fur to search for any ticks. They absolutely love the very warm, moist air, like inside the ears. So you can check the ears, you can check underneath the tail, inside the web of the toes. And if you find a tick, it's highly likely that you have a tick fever problem, and it's absolutely you need to get some attention if the signs start to progress. Because usually if they get a tick bite and they don't get sick, that means the tick was not infected. But if they get sick, that means the tick had the bacteria and it gave it to them, so that needs some urgent medical attention.
So we should be checking our dogs for ticks.
Should be checking,
so you should always be rubbing your hand along their back, checking behind the ears, in the ears, all of that stuff. And ticks come in all shape and size.
All shape and size, especially if you live in areas that are nicely, you know, you have your nice topography, your nice little, what do you call it, landscape, your nice grass and stuff. So if you have all that grass and stuff, you absolutely have to check. And if you live in areas like, you know, in the rural areas that have cows and goats, they can spread the ticks very easily. So you always have to check.
Talk about spreading, because I mean, you have a number of dogs at home. Can one spread it to the other?
Absolutely. And if you have shared fencing too, so maybe you're here taking care of your animals, but your neighbor maybe not, you know, treating theirs, they can easily crawl under the fence, or if they play together at the fence line, they can easily get that.
Itchy. Because ticks can bite us too,
yes,
right?
they can,
and that's
we
a big
can
problem.
get ticks. Absolutely.
So when you identify and find the ticks, what do you do?
After you find the ticks, you can first you need to get is if if the animal is not sick, you can just get a spot on, a pour on, or you can get the Next Guard. I prefer the Next Guard. It's an oral chewable, beef flavored, lovely tasting. You give that to the animal, and it usually just get rid of the ticks in like seconds. Because it works inside out.
So are we waiting for ticks to show up before we treat for ticks?
Absolutely not.
Or is that part of...
Absolutely not. Prevention is so much better than cure when it comes to tick fever. So you want to, after you check your dogs, even if you don't, you want to have that in your normal routine. Just as how you make sure that they're covered for deworming and heartworm prevention. Ticks and flea medication should be one of your top priorities. So every month, it's recommended every month that you give a Next Guard. And it usually go by weight. If not the Next Guard, you can get a flea and tick collar from one of your local pet shops. Your local Nutrimix has it as well, because they all fall under true. So you can get it from them. And you can get the pour on, whichever one you prefer. You want to have that every single month. And the good thing is those mostly don't cover just for ticks. It covers for flea as well and for mites. So you get a broad covering.
I have one last question to ask. Cats.
If they can get tick fever too, it's not very common for ticks to get it.
That's just a dog thing.
Cats a dog thing, and for goats and other ruminants. But cats normally, cats are like those superior pets that barely get. They're very clean.
Yeah, I'm really nervous about ticks biting us because you can get, I think it's Lyme's disease, right?
Absolutely, yes, you can. Yes, you can, and that's very serious disease.
So we'll take a Next Guard?
No, you don't. But you try to avoid, especially when you go hiking in Blue Mountain. You try to make sure that you're covered and check your body when you come home. Because a lot of times, I grew up in St. Thomas, so my grandmother had cattle. Sometimes I'll be going home and I just feel a little scratch. And when I look at it, I'm like a tick, and just pull it away like that. But the good thing though, Jamaica, we have never really had any problem with Lyme disease. So thank God, rabies and Lyme disease is not one of our
I know that we have
issues.
to wrap, but as you said that, you know, I have a lot of freckles and moles and things. And one time, one tick did that on me, and my chief said, I thought it was a new mole.
Yeah.
And then one day, Mr. Bond, that mole is bad on me. Look at that. Why do I always have these stories? I can't.
Listen, that was Mickha Francis.
Thank you so much.
Not a problem, not a problem.
It's a brand new segment, but I'm so sure it's
I feel
approved.
so itchy.
Sunrise Poppy Show. Yeah, what a segue. Poppy Show. You've never seen a sunrise quite like this.
I
You
have
don't want to
the
miss it. Ick. Tick. So what do adults do? And people?
Get like this,
Humans.